More coronavirus coverage as promised. More than 24 healthcare workers in the North Country got a pink slip today. They were let go because they weren't vaccinated by deadline. Local 22's Jolie Sherman live in Plattsburgh tonight as New York's vaccine mandate for healthcare workers is now in effect. Jolie?
Lauren, while some healthcare workers qualify for religious or medical exemptions, 3 hospitals in the North Country that are part of UVM's health network let go of more than 30 unvaccinated individuals today. But hospital leaders say due to staffing shortages, losing just one healthcare worker is too many. For some unvaccinated healthcare workers in New York, Tuesday marked their last day. That was the reality for 12 healthcare workers at CVPH, 16 at Alice Hyde Medical Center, and 5 at Elizabethtown Community Hospital.
We'll say losing a single individual today in any role in any department has a significant impact to our organization as we're already workforce challenged.
New York requires all healthcare workers to get vaccinated. I spoke with a nurse who asked to remain anonymous. She is vaccinated, but doesn't agree with the mandate.
Just because healthcare workers, there's such a shortage of us already, that getting rid of the ones that don't want to have the vaccine, we're going down to really bad levels.
As of Tuesday, all services at CVPH are still running, something Chief Nursing Officer was worried about. But they managed to fill the gaps and plan to hire more staff.
We are continuing to actively recruit and onboard traveling staff in key areas, so that includes nursing, laboratory, respiratory therapy, and other areas.
She says CVPH continues to see more COVID patients, putting departments at or near capacity. The same is true at Alice Hyde Medical Center in Malone.
We've deployed staff to our impacted areas. In fact, at Alice Hyde last week, we had to close our intermediate care unit and relocate staffing to our ED.
Alice Hyde's Associate Vice President says she couldn't answer why some of her colleagues didn't get vaccinated, but has always encouraged staff members to do so.
I'm basically a nurse, a scientist, and I followed the science, so I got vaccinated. I can't speak to anyone else's personal preferences.
Like her colleague, Canning believes in the vaccine mandate as well.
It's a tool that's helping us as a community move forward, and I do believe it's the right thing to do.
Now, healthcare workers can get their jobs back if they change their mind about getting vaccinated. Health leaders at CVPH and Alice Hyde Medical Center say they would just need to reach back out. Reporting live in Plattsburgh tonight, Jolie Sherman, Local 22 News.